If you're having gallbladder symptoms caused by gallstones or other conditions, your doctor may recommend a surgical procedure as part of your treatment. In most cases, surgery means removing the gallbladder, but there may be other alternatives in certain situations, and there's more than one way to perform gallbladder removal surgery. Here are 3 surgical options that your doctor may discuss with you, and what to expect from each procedure. Hi, I'm Joshua, and I am here to help you with your stomach pain relief here in the Stomach Help channel. Now, let's continue with the video. Cholecystectomy, gallbladder removal. This is the medical term for surgery to completely remove the gallbladder. In the United States, cholecystectomy is a very common operation. Most gallbladder removal surgeries are performed because of gallstones. Specific reasons for the surgery include gallstones in the gallbladder that cause pain, gallstones in the bile ducts that cause pain, gallbladder inflammation, usually due to obstructed bile ducts from gallstones, pancreas inflammation, pancreatitis due to gallstones. There are 2 main methods of performing gallbladder removal: laparoscopic and open. Both methods are performed under general anesthesia, so you'll be completely out during the procedure. Laparoscopic method. Most surgeons will opt for this method if possible, in which the gallbladder is removed through a series of small incisions in the abdomen. Laparoscopy is a band-aid surgery, and the recovery is much easier, says Harold Burensway, MD, a gastroenterologist and the executive vice president at Texas Health Harris Methodist in Fort Worth, Texas. Well, what do you think about these? Have you experienced this or tried some? Comment down below your experiences. And if you think these are useful, a like and subscribe would be really awesome for the growth of my channel. And also, don't forget about the bell icon below. Let's get it on. Some patients can go home the same day, Dr. Burensway adds. Others may need to spend 1 night in the hospital. In this surgery, 3 to 4 small incisions are made in the abdominal wall. Your surgeon inserts a laparoscope, a flexible tube containing a light and tiny video camera, into one incision, and surgical instruments into the others. Your surgeon performs the procedure while looking at a video monitor, and then the gallbladder is pulled out through one of the incisions. At this point, your surgeon may order an imaging test, such as an X-ray or ultrasound, to look for gallstones or other problems in your bile ducts that weren't visible using the laparoscope. If everything looks fine, your incisions will be sutured, and you'll be taken to a recovery area. The entire procedure takes 1 to 2 hours. Open method. It's possible that your surgeon won't be able to reach your gallbladder using the laparoscopic method, potentially due to scar tissue from previous surgeries that makes a larger incision necessary. If this happens, or if other complications occur, your surgeon may opt for an open surgery. This method involves making an incision measuring roughly 6 inches, 15 centimeters, on the upper right side of your abdomen. This larger incision cuts through muscles, which results in more pain and discomfort later. These muscles and other tissue are pulled back to expose your liver and gallbladder, which your surgeon then removes. Your incision will then be sutured, and 1 or more drains may be placed in it to allow fluid or pus to flow out. While an open cholecystectomy takes about the same amount of time to perform as the laparoscopic version, it results in a longer recovery time due to the larger incision. You can expect to spend 2 to 3 days in the hospital, after which you'll need 4 to 6 weeks to recover from the surgery. After either type of surgery, a dressing or adhesive strips will be applied to your sutured incisions. Your gallbladder will be sent to a lab for analysis. Endoscopic retrograde cholangioppancreatography, ERC. This procedure is used to view and treat a bile duct that has become blocked or narrowed. A blockage can happen when 1 or more gallstones migrate out of the gallbladder and into the common bile duct, which carries bile to the small intestine. During ERC, an endoscope, a flexible tube with a light and tiny camera on it, is guided down your throat into your stomach and small intestine. A thin tube called a catheter is inserted through the endoscope and into the opening of the bile ducts, where a special dye is injected to make the ducts more visible on an X-ray. If blockages or narrowed areas are then seen on an X-ray, surgical tools can be inserted through the endoscope to fix the problem. You'll probably be awake during an ERC, but you'll be given a sedative to help you relax. ERC is often performed in conjunction with gallbladder removal. Colecystostomy, gallbladder draining. Draining the gallbladder is usually done only as a temporary measure to relieve swelling when surgery to remove the gallbladder can't be performed right away. It's sometimes a good option for people with severe gallbladder problems who have other conditions that would make gallbladder removal a risky procedure. During this minimally invasive procedure, your doctor will insert a needle through your abdomen into the gallbladder. A tiny tube, called a catheter, will be inserted through the needle to drain the gallbladder of bile and decompress it. A drainage bag or bowl will be attached to the end of the catheter to collect excess bile. The catheter and bag will be attached for a few days to several weeks. With cholecystostomy, you are still left with a gallbladder full of gallstones, Birensweg notes. That's why it's almost always done with an eye toward future gallbladder removal. A non-surgical option. A rarely used method for treating gallstones is lithotripsy, which uses high-energy sound waves to break the stones into tiny pieces so they can drain out of the gallbladder. This procedure is sometimes used in combination with oral drugs that can help dissolve or break up gallstones, but it's unlikely that your surgeon will recommend lithotripsy for your gallstones. I don't know of anyone who's had that done lately, Birensweg says.